All right, welcome everyone. Lovely to see you all. So my name is Dr. Alana Roy, and I'm here with Nigel Denning. And tonight we're going to explore the certificate in psychedelic therapies, and we'll have plenty of time for Q&A. So before we begin, I'd really just like to take a moment to, if we can, just to drop into acknowledging the traditional owners of all the corners and lands of Australia in which we're from, and really acknowledging their contribution, past, present, and emerging, and paying deep respects to all the altars around the world that have used these medicines for ritual, for medicine, for community, culture, and connection, and particularly those communities that are suffering during COVID at the moment due to lack of tourism. And also acknowledging all of us and all of the people that have experienced mental health challenges, and that's ultimately why we're here, is to discuss new and emerging treatments and the potential for psychedelics as we make our way through the mystery of life that we're all a part of. So yeah, warmly welcome you all tonight. Next slide, please. So just before we begin, my background, I'm a social worker and a psychologist, and I'm the National Practice Manager of Mind Medicine Psychological Support Services. And I started that about a year ago. So Mind Medicine has been around for 2 years, but the Psychological Support Service began a year ago. And I'm also the co-lead on the Certificate of Psychedelic Therapies with Nigel and Tra-ill and Melissa and a great team of academic support. So just briefly, some of you may have already seen these slides from our other webinars, so we've just got some reduced slides tonight to go through. But as I'm sure you're all aware, the huge statistics on mental health in Australia. Given we're one of the most wealthiest countries in the world, we also have some of the most shocking statistics for mental illness, with up to 1 in 5 Australians experiencing chronic mental health issues, and 1 in 8 people taking antidepressants, including 1 in 4 older people. So there has been a huge increase in the use of medications, 95% increase in the last 15 years. We know that 1 in 30 children can be on antidepressants, and as young as 4 years of age. And there hasn't really been any significant breakthroughs in psychiatric medication. These medicines, although they can help, they often can act as a band-aid to kind of suppress mental health challenges, and there can be a range of side effects. As we know that the most common high prevalent mental health conditions are post-traumatic disorder, anxiety disorders, depression, and substance abuse. And that's our main focus at Mind Medicine. Okay. Next slide. Okay. So there's been no improvement in treatment in the last 50 years, and hence the need and the renaissance into psychedelic medicines, that we need better solutions and better treatments and tools for our clients. We know that only 35% of people who have depression experience remission from pharmacotherapy, and between 40 and 60% show some response, but as soon as they stop taking the medication, they can relapse. So there's a high chance of relapse once people stop antidepressants. And with PTSD in particular, remission rates can be as low as 5%. So as we say at Mind Medicine, more of this same approach is not going to solve the problem. We can do better, and we're at the frontier of a renaissance into psychedelic science, which is incredibly exciting. Next slide. So Mind Medicine Australia is a not-for-profit charity which was established by Tanya de Jong and Peter Hunt. They're philanthropists and entrepreneurs, and they dedicate all their time to this charity. And we're a small incredible team of very hardworking, dedicated people. I'm sure if you've been watching all the social media and the news, we've done an incredible job in 2 years, and we're really excited to expand this and to expand the certificate of psychedelic therapies around Australia, and really see the system, the mental health system, be changed from the inside out. Our primary focus is on psilocybin for major depression and medicinal MDMA for PTSD, in conjunction with therapy. However, we also, of course, keeping up with the research and have interest in other medicines such as ketamine, ibogaine, DMT, and ayahuasca. And the integration service that I run, which I'll talk about later, covers a whole range of psychedelic medicines, which we support people in the community with harm minimization. So I guess we will know that we have been successful when someone with a mental health issue can go to a GP and discuss their symptoms, and the GP can talk to them with full disclosure about the risks and benefits of therapy, of antidepressants, as well as psychedelic-assisted therapy, and that there is affordable and accessible pathways for people with mental illness to be able to have psychedelic-assisted psychotherapy, and that be an option at that first point of call with their GP. We know we'll have success when we see significant reduction in remission rates, and that these medicines are working, and people aren't just putting a band-aid on for their trauma and symptoms. They're actually becoming connected, healing, and thriving in the community. Next slides. And I'm sure many of you know that psychedelic-assisted psychotherapy typically involves 2 or 3 dosed sessions in conjunction with assessment, preparation, and integration. And the research is suggesting that it's, these medicines are potentially curative, not palliative. You don't, unlike many people who take antidepressants, they take an antidepressant every day, 10, 20, 30 years, and often multiple medications for their whole life in this chronic mental health condition. What we're seeing with the potential of psychedelics is that 2 or 3 dose sessions are having remission rates of up to 60 to 80% effectiveness. And hence that's why they've been granted breakthrough therapy designation by the FDA, the Food and Drug Administration in the US, and being fast-tracked for approval, which is incredibly exciting, the phase 3 rollout of studies. So I'm really excited to see what that data brings in the coming months. Next slide. And this, I'm sure you've seen this slide before. What we have here is the psilocybin fMRI scan and the placebo. And we can see here that the brain is connected, it's communicating, it's lit up, often the default mode network, which hosts our rumination, our rigid personality structures, our traumas, our obsessions, our neurosis, goes offline. The brain lights up, and people are able to go beyond themselves. They're able to transcend their pain, their trauma, and open up to other possibilities of being, and bringing that back and connecting to the world and to the community. So this therapy, it enables people to break out of repetitive thinking and behaving, and promotes active coping. And Nigel will discuss some of this in detail later, the capacity of those metacognitive abilities, which we're not seeing in traditional treatments at the moment. Next slide. So our 4 key strategic areas is building awareness and knowledge in the community through local chapters, through social events, summits, webinars like tonight, courses and programs that we run through our integration service, and also the CPAT, the professional development program. And we've just about finished our first cohort, which has been an absolute incredible journey, an absolute honour to be part of this process with some really incredible practitioners who are pioneers in the field and have been the first group to take this stand and believe in these medicines and their potential. We're also establishing Asia Pacific Centre for Emerging Mental Health Therapies, And I guess the goal of that is to develop supply chains potentially in Australia, so we can grow these medicines in the Australian context, education, manufacturing, and building an ecosystem of medicine here in Australia from an ethical and not-for-profit accessible capacity to the best of our ability. And of course, access to medically approved therapy. We're not-for-profit. Our goal is to make this as accessible as possible as a frontline treatment. Next slide. Okay, and next one. So just briefly, the service that I established, the psychological support service, I guess the pillars that really inspire me and what I guess ground me in my work as a clinician and as a human being, and what I ultimately wanted to grow in Australia, and that is courage, to have the courage to explore medicine and self. And our clients require deep amounts of courage to live with the trauma and suffering they have, and also to take that plunge into psychedelic medicine, and the courage of practitioners to be able to hold them in that space. And integrity, to embody safety, truth, and a strong moral compass. And that's definitely what my members of the team that I'm looking for when they are recruited to be a subcontractor, is to be safe, to have a strong moral compass, and to help clients be able to really embody their truth and be grounded in integrity. And community, which is everything. It's that, through relationships is how we live and grow and heal and hurt. And I guess a big part of my medicine is establishing a network of psychedelic aware practitioners all around Australia, volunteers who attend chapters, events, so that we can heal together and connect and really fix the huge amounts of isolation that are here in Australia, and even more so after COVID. And integration, to engage with science and the sacred. So ultimately, what we're wanting to do with the certificate in psychedelic therapies is to bring together multidisciplinary fields, so that there is not one paradigm, there's not one voice running the show in mental health. We want to bring together the best of multidisciplinary practitioners, provide an integrated model of health, and then clients can engage with psychedelics and then ultimately integrate their trauma into healing and then into the world, into the community. Okay, next slide. So the overall goal is to provide a safe and professional psychological service for those who need support for psychedelics, plant medicine, and their emotional health and well-being. And we've got a small team of people who are really dedicated to this field and have a lot of knowledge and experience. And we do counselling, assessment, group work through integration groups. We have study groups as well, and supervision, professional consultations, and of course people can access through the normal means of funding, as well as NDIS. We've had people use their NDIS packages for integration. So even though my medicine isn't endorsing illegal use of psychedelics, this service is here to support those who are choosing to do that as safe as possible through harm minimisation and community. And people who are enrolled in CPAT are often invited to apply to become part of this team, so that we can help support and grow people's practices and their learning journey through our referral networks. Next slide. A quote from Tim Ferriss: I view the next 5 years as an absolutely golden window. There's an opportunity to use relatively small amounts of money to have billions of dollars of impact in terms of helping people heal mental illness and to affect millions of lives. There just aren't that many opportunities that are so dramatically obvious. If you want to bend the arc of history, I think this is one of the best opportunities we'll ever have. And, we're at the forefront. We're pioneering a renaissance. This could, and it will, we believe, have a serious, significant impact on the health and well-being of Australians. And we invite you to be part of it and be part of the change and help change the system so that we're more integrated and connected for our clients. Next slide. Oh, I think you all know how to reach out to us, but there's many ways you can start a conversation, share our information with your friends, your colleagues, skeptics, people who are concerned, people who are angry. Have a discussion and get people talking and shake it up. We have lots of resources on our Learn section on our website to get really educated in, bite-sized chunks so that you can help break down the stigma of psychedelics in the community. We have lots of opportunities for volunteering, student placements, regional chapters, and of course the International Summit coming up. And without donations, we can't do this. So it does take people to believe in this and get on board with support. Next slide. All right, I might start handing it over to you, Nigel. How does that sound? And if you want to share just a little bit about your qualifications and your backgrounds, that would be awesome.
So thanks, Alana. That was a great intro, and hi everyone that's joined us this evening. My name's Nigel Denning. I'm a counselling psychologist. I have a practice in East Melbourne. We have a psychology, psychotherapy and psychiatry practice. And we specialise in working with trauma, working with issues of development and issues of personal growth. About 35 years ago, I first got exposed to transpersonal psychology and the work of Stanislav Grof. I went on to work with Stan for a number of years, and I've done a lot of work in non-ordinary states. I'm a meditator. I follow a particular path of Tibetan Buddhist meditation, but I use that more as a skill set than a religious sort of system. And I'm just really excited to be part. Well, I'm quite new to mind medicine. Tra-ill Dowie and myself, my partner, working partner, got involved with mind medicine at the end of last year. So we've been working really hard at trying to really present a really good training program for the certificate in psychedelic-assisted therapy. And we're really happy with what we're producing, and really happy to have an opportunity to reach out to people from this paradigm. Western psychology has become really fixated with observing negative symptom, managing and controlling negative symptom, looking at the pathologies, looking at the illnesses, and we've got a very good set of skills to be able to identify that. But by identifying the negative doesn't necessarily produce the positive opposite. There's been a growth in positive psychology as a movement in the last decade or so, where there's a real kind of need for growth, for people to experience something different, people to have something more hopeful than taking an antidepressant or taking another symptom suppressant. Whilst they help some people and they can save lives, so we're certainly not anti the current medication regimes or anything, but we just think that what we have here is an option that will work for some people in a much more constructive way, a growth-based way. And that's really what we're trying to do with the certificate in psychedelic-assisted therapy, is really show that there's an opportunity here, not solely from the medicine itself. Medicine we see as a vector, as a tool. And what we're really trying to work with is the organisation of mind. What we think is that people that are suffering because they're trapped into rigid patterns of functioning and being. And whilst we can identify those patterns with the Western psychological model, and we can treat them with some symptom relief, some therapies can be very good for some things, but we think that this opportunity to introduce a psychedelic medicine or an empathogenic medicine, depending on presentation, really gives an option, really gives people an option to what we understand from success with psychedelic medicine is people having the experience of the numinous, as Carl Jung described it, or a transcendent experience. Alana was talking about this movement beyond the default mode network, a biologically based rigidity of organisation at the biological level, which itself reflects and manifests as a rigidity in symptom, rigidity in how we are in the world. And so psychedelic medicine is a way of opening to possibility. And what we're doing in the certificate course is trying to train people in how to manage that in an appropriate way, and also how to help people integrate those experiences so that it's not just a profound change that happens to someone because they've ingested something and then they kind of convert back to normal over a period of weeks or months. What we're trying to do is help people to integrate a new experience into a new understanding of self. What we're doing there, it's a reorganisation of mind into new possibility. That's really what we're trying to convey in the certificate program, and giving a set of skills for people to understand good old Rogerian kind of qualities around respect for the individual, respect for people's subjectivity, respect for people's growth and potential, and the role that therapy plays in providing a container to allow that kind of growth. And we see medicine as really providing an important tool. It's a really exciting new paradigm that we're working with, where we're really starting to think about, you know, what human growth is and what human consciousness is, and how we can help improve people's lives in a really transformative way, rather than just a band-aid kind of way. So we don't want to present it as a panacea, because it's not going to work for everyone across everything. So, you know, we want to be reasonable in our assessments. So, you know, but for people where it does work, can work exceptionally well. It's just a really good opportunity for us as therapists to work in this manner. So, as Alana was saying, we've finished we're coming towards the end now. We've got about a month left of our first cohort of 50 participants. And as Alana was also saying, what we're working with is an attempt to also engage multiple strands of the puzzle. So we're trying to weave together anthropology, psychiatry, medicine, psychology, history, spirituality. We're trying to weave these kind of very complex human processes and create something that's multidimensional. So in our cohort, we've got psychologists, psychiatrists, general practitioners, counsellors, art therapists, and we've got other allied health professionals in there, because we're really not trying to privilege or prioritise any particular theoretical orientation. What we're trying to say in this work is that if we come together as a group, as we come together as a collective, if we share our knowledge as a tribe, if we share our knowledge as a circle of people concerned with really making a positive, impactful change, then there's a lot that we've all got to offer into this process. And that's how we're structuring the training. And so far, touch wood, we've had some pretty good feedback from the group that we're really kind of meeting those goals. It's a really important and an exciting opportunity in Australia to be at the forefront of this work, and then be ushering in a new paradigm. When I met, for those of you who know, Stanislav Grof was the primary researcher at Maryland Medical Centre when LSD psychotherapy was still a valid and very promising research tool back in the 60s and early 70s. And he worked with quite complex forensic and psychiatric cases with quite positive and quite good outcome results. But then, of course, there was a change in politics and change in cultural mood, and so all of those opportunities were shut down fairly quickly. And Stan ended up developing a kind of a surrogate practice called Holotropic Breathwork, which is you create a non-ordinary state through rapid breathing to music supported in a group. And that's sort of existed now for 35 years. That's been a way to kind of manage and to maintain the skills of people working on an non-ordinary state. But when I was working with Stan and entered into this work 35 years ago, I really didn't think I'd see this in my lifetime, the opportunity to explore these medicines. So it's been quite a remarkable opportunity, and it's happening very quickly. It's unpacking very quickly. So what we're trying to do is bring this work through in the most ethical and sensible and balanced way that we can. And we hold in deep respect these great anthropological traditions that have held this work for eons. All cultures have medicine work somewhere in their origin. So we try and on one hand hold this sort of sacred continuity, whilst also trying to balance it with the rigors of science and ethical practice. What should be gold standard treatment in this area? So we're really wanting to test and be challenged and to question the work we're doing, whilst also engaging very enthusiastically in what we believe is a really good opportunity for us all collectively as a culture. As Alana was saying, we've got we've really hit a bit of a brick wall in terms of treatment options in psychotherapy and in medicine for psychological suffering. So this is an incredible opportunity for us all to share in something really interesting.
Thanks, Nigel. So was there anything else, Nigel? Are you right we can open up to questions. We've got half an hour. Plenty of time to unpack any questions. I guess I should mention the selection criteria for CPAT. So it is people need to have a bachelor in a relevant field, and then 3 years post-qualifying experience of supervised practice and references to support that. And so, as Nigel mentioned, we have GPs, psychiatrists, psychotherapists, we have social workers, counsellors, we've had paramedics and nurses as well. And they will have different roles within psychedelic-assisted psychotherapy when it rolls out. And it is an emerging field, and there's a lot of unknowns as the models develop and the research occurs in Australia. But there will be prescribers such as psychiatrists and GPs, and then the primary lead therapist who has to have that extensive therapy experience. And they will do the preparation and integration work and be in the room. And there will be a secondary therapist who could be, for example, the social worker, the paramedic. They have the clinical skills, but they may not have had that therapeutic experience. And people have to work in that combination. So there has to be a medical professional on site to administer the medicine and to be there for any intervention if needed, which is extremely rare. And 2 people in the room, most likely a male and female split for safety. That's ideal. And from a clinical trial point of view, most of these journeys are recorded for safety and for review for inter-rater reliability and things like that. So that's the general structure and criteria to get into the course.
The course we're teaching has 12 steps, the treatment model. So it begins with a detailed assessment, an intake, and an assessment. That assessment will involve case history, but also psychometric assessments, just to make sure we're really kind of zeroing in on who the person we're working with is. So we really want to understand who the person is rather than what the symptoms are. So symptoms are an expression of something underlying. So we really want to spend time understanding, getting to know, detailing. Then we work through an introduction to psychedelic work or empathogenic work. So we have some introductory sessions which describe what the experience will be like for people, could be like, the kind of range of experiences, so preparing them for that. We also talk about ways to move both in and out of these medicine experiences. So really working with what we describe as metacognition, using a practice called mentalization. And it's really anyone that's worked in the mental health field or does counselling would be familiar with this while maybe not knowing the terminology, but it's just really just helping people to track and understand the phenomena of themselves in relation to another. So it's really helping people to track and to understand and identify and label. We use that as a principal skill because what we don't want to be doing when we take people into a non-ordinary state is impose our own values, our own views. So we try and keep ourselves not inactive. We don't sit passively by. We want to be engaged with that person, but the training and for the program that we're wanting to deliver is one of service to the subjectivity of the other. And so what we're really trying to do is minimise our theoretical impact whilst holding an ethical and systematic position, really trying to help people's skills so that they enter into the experience, can derive the most from that experience, and then reorganise on the other side of that experience in a way different to which they entered it. So we're really trying to help people understand themselves in a different way, understand the nature of the problems that they've brought into therapy in a different way. So it's quite a structured process that we're training people to go through in this. In many ways, it mirrors, as Alana said, some of the trial treatment protocols that are going on around the world. But we're really trying to teach more to a therapeutic audience rather than a research audience. So whilst research programs tend to be a lot more narrow in focus or constrained in who they bring in, we're really trying to broaden our training to as large a group as is ethically possible for us to manage, both as therapists and also as potential clients of the service. So it's a 12 steps, 12 stage structure that we're teaching, which involves assessment, preparation, treatment, integration, exiting. It's a very defined model of a set number of sessions.
All right, does anyone have any questions? You can put your hand up using the little yellow hand icon, or you can write it in the chat, or you can just yell out, whatever works for you. Oh, we've got Kerry, you're on mute. If you want to take yourself off mute, Kerry. Yeah.
Better put a microphone on there.
See if I can do it.
Yep, there we go.
Can you hear me now?
Yes.
Yep. Thanks,
You
Kerry.
can.
Yes.
You can hear me, but I can't hear you. That's interesting. Anyway, the thing I've been listening to it, which is wonderful. I want to invite as many of my contacts on Facebook to like my mind medicine, but there's not sort of like a something with some groups. It's you can invite someone, and then I could send it to all of my contacts. But with the mind medicine one, I haven't been able to find something where I can actually invite everyone.
Yeah. Diogo, Scarlett, can you make a note of that, please?
Yeah, thank you. That's an interesting comment. We'd definitely like to address that. So we'll have a look on the back end, yeah, and make sure that's possible. Thank you for bringing that up.
Thanks, guys.
Yeah, I just want to spread it.
Thanks for that, Kerry. Wonderful. Thanks for the support.
Pleasure. Saved my life.
Oh, wonderful.
Any other questions?
Yeah, I have a question.
Yes, Gary.
Yeah, it's Gary Outen here. When does the course start? And is that in November that you mentioned, in November this year?
We've got the next intake coming up in, I think, July, isn't it, Alana? The next course starts.
Yes, that's right. All the dates is on the My Medicine web page. There's a CPAT section, and it's got teachers, the course outline, the fees, eligibility, all the information's there. You might be getting confused with the summit, and I'll show a slide before we finish tonight on the psychedelic summit that we have in November.
Okay, so I haven't looked on the website, so all my questions would be around probably what's available on that website. And I live in Adelaide. There's no when I did look on your website, there's no kind of practitioners west of the East Coast. So is there some opportunity for people to start practicing here in Adelaide, or are there people about to do that?
So at the moment, to be, because we've only been around for 12 months, the psychological support service, the criteria is for the practitioners to complete CPAT to be on the team, so that I know that the team that I'm working with has done this training and has those skills. So we've got a small team at the moment that a lot of work remotely via Zoom as well, which obviously is not ideal for everyone, but during COVID, serviced hundreds of people. But absolutely, we'll be expanding all around Australia as each cohort goes through, and people join our team.
Just in terms of the acceptance of the therapy, I've recently spoke to a psychiatrist here in Adelaide who's really excited about it, but also really frustrated by how long it's going to take for it to become an acceptable treatment. That I wonder if you could just maybe, what's your thinking around?
We're not far off it at all, Gary.
Yeah.
No. There's the acceleration of interest and research over the last 3 or 4 years is extraordinary. We've got legalization in a couple of states in the US. We've got legalization in Europe. The outcome studies are quite extraordinary. So the weight of evidence for this work is a little bit hard for regulators to kind of hold back for much longer. We're just really
about Australia here, Nigel. Sorry.
Yeah, very, 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 very imminent.
Okay.
We're talking in the next year or two. We've got trials already running in Australia. So this is all. The TGA knocked back rescheduling just a month ago, but there's an appeal on for that at the moment. So it could be this year, could be next year. We're just really waiting for government to catch up with the science, really, but it's not that far off, which is why we're working our butts off to train as many people as we can in preparation for this work.
Just to acknowledge there, the work of Mind Medicine through the rescheduling process, that even though the first round that the government said no, ultimately TGA said no, they made that decision, and a couple of weeks later the government has put out 15 million in potential grants for research. So Australia went from being one of the least funded countries in the world to second in the world for psychedelic research. So they've listened to the applications. They have responded, but what they're saying is we need more research. And I also just want to acknowledge that currently the Royal Academy of Psychiatry doesn't endorse psychedelics or CBD and THC. And we know that CBD and THC is now used widely and has gone through a huge shift where it used to be extremely hard to get, and very severe cases. And now people can go and get CBD and THC for, if they've had one antidepressant that hasn't worked, for example. So that's a huge shift that happened in our culture, and psychiatrists didn't support that shift. We hope that they will get on board with this. But by assembling an integrative team of professionals, professions, it's not just one voice, it's multiple voices leading this change, and it absolutely will happen.
And we've already got commercial preparation for supply. I mean, that's already starting. MDMA production, psilocybin production, it's already, people are gearing up to produce. So it's inevitable in a very short period of time.
Great, that's really encouraging.
Yeah. Look, I as I say, I've spent 30 years kind of not thinking that I would see this in my working life. So quite remarkable to see it unfolding so quickly, and very, very, very much needed. There's a question here, Alana. I don't qualify for the course, but I wonder if there's an approved route to become a test client, a subject for trainee sessions. Do you want to say anything about that?
At the moment, it's looking like our future studies will be with CPAT students. So we'll be most likely and hopefully relatively soon doing dosed sessions with CPAT students. But yeah, I'm not aware of, unless there's mental health issues and you get approved through a research program or another healthy trial occurs, that would be your best bet. So you just have to stay tuned to social media. But at the moment, it's complex mental health is the focus for trials.
Another question here from Troy. As someone currently studying a postgrad in psych, do you have any advice in gaining experience in a student placement? So Mind Medicine does student placement. My practice, integrative psychology, we do student placement. So there are options. Alana, did you want to say something?
Yeah, absolutely. And what we're hoping is that we can embed student placements into the CPAT program so people can be, doing both at the same time. And then we can also provide affordable treatments for people undergoing psychedelic-assisted therapy, because part of it will be, a student contingency will be supporting some of that payment. So I guess just get to know us, get connected, and as opportunities unfold, placements can occur. Yeah, we have student study groups and supervision and all sorts of things. So yeah, you can just email me if you need more information. All right, we might go to, is it Erica?
Hi, so I'm currently finishing my clinical psych master's and looking to get into this field. I'm right now in Europe, originally born in Canada, lived in Australia for 2 years. So I'm trying to figure out where I want to get trained so that that's where I'd eventually settle. My question is, are you affiliated or in contact with other places that are doing similar certificate trainings? Like I know Fluence in the States does something similar. Synthesis, I believe in the Netherlands, is starting some kind of training. I'm not sure if any of these companies, including yourselves, are connected. Is there going to be sort of like my ability to go back and forth?
Yeah, so I guess we're connected in the sense that it's a large community of psychedelic researchers and organisations, and we're connected to MAPS. Dublin often presents with us, but accreditation is a different process, and international accreditation. I don't think that even occurs at the moment. Correct me if I'm wrong, Nigel. But what we will see is overarching bodies in Australia, and then international bodies join and all of that in time. But at the moment, it's very early days.
Yeah, there's trainings all over the world, and there are new ones opening up everywhere, but they're not registered or affiliated in any kind of formal way. So you'd really, depending on what country you find yourself wanting to practice in, Erica, you'd want to check what the registration requirements are in that particular country, and in who's providing private services at this stage. Some of it's through universities, and some of it is done through charities like Mind Medicine.
So there's another question here. Test patients being CPAT students mean that every CPAT student will be required to participate as a client and take the medicine. I ask this because although I'm not currently enrolled, I may in future and don't especially want to take MDMA ever again. So no one would ever be forced to do anything they don't want to do. It will be an option. And the goal would be to have MDMA and psilocybin and potential for group work with the students. And if one of the components of CPAT is to have gone through an altered state of consciousness as a criteria. So the holotropic breathwork would be another option, which may be more comfortable for you.
We, as part of the training in the CPAT, we offer two rounds of holotropic breathwork. So this is a non-medical, non-medicinal access to an ordinary state. It's done. So I've been practicing it for about 35 years. So I've had a reasonable amount to do with it. And it has a very, very strong correlation with, I've also had experience overseas with different medicines, and there are very, very strong correlations with the holotropic work and non-ordinary states from other types of inducement. So it's a really good analog tool. The thing about the holotropic work is that, unlike a medicine where you really, once you've ingested something, you have to wait for your body to metabolize it, the breath work people can kind of pull out of it at any point. So if they get into something that's really difficult and not something that they're wanting to kind of process, then you can come back away. Not that we have a lot of experience of that, because what we do is work very, very much around trying to support people and to create safety, to create trust, so that we can encourage people to take an attitude of curiosity towards the unfolding of themselves. So the whole purpose of the container of both the training and the therapy is to encourage exploration. So we don't encourage traumatization or people to go into things that they don't want to go into or are overwhelmed by. That's the whole purpose of the work, is to help people heal, not to traumatize them.
Absolutely. And without going into your situation there, Rebecca, obviously the MDMA, it's pure, it's medical grade, it's at a dose that people don't get the serotonin dump and awful come downs the next day, and so it's very different setting than what's typically out there, and of course with therapy to hold that space. So yeah, but there'll be options, and students will have hopefully we'll have that choice once we all get it through ethics and up and running. Okay, Katie. If you're there, Katie.
Hi, can you hear me? Hello, how you guys doing? I'm a trainee psychiatrist. I'm based in the Byron Bay hinterland, working at Lismore Base Hospital. Excited to have been accepted already onto the CPAT, so I'm looking forward to working with you guys. My question is, what is the exact structure of the training that we're going to be doing? I understand that some of it's online, and other bits are sort of there's I think 2 residential weekends and a week.
Three workshop weekends. So we do a non-residential 3-day at the start, where people come together in Melbourne. Then we do a residential about a month later, and that's where we work with a holotropic and some other structures around that. And then a month later, we have a 5 or 6 day residential retreat where we're really trying to hone some of the therapeutic skills around integration, support. So really working with preparation, working with collaboration, working with metacognition and mentalization as ways to move people in and out of non-ordinary state. We also work with the techniques of holding people whilst in a non-ordinary state. So we're trying to make it as hands-on as we can. In between the residentials, we provide a series of webinars from some of the world's leading experts in the field, both researchers and practitioners. And we also have reading, significant reading, structured reading through the process of the course. And we do webinars where we take question and answer about the week's readings. So we kind of intersperse those with the webinars from world leaders.
Mm. And this group's actually started their own private chat, which has been extremely active. I can't keep up. Some days, up to 50 messages. So with articles and all sorts of, referrals and discussions. So it's, a community, a really solid community developed really quickly, which was beautiful to see.
We work very hard at creating a collaborative structure to the training cohort. It becomes very, very mutually supportive group.
Does that answer
Thank you,
Katie? Yeah, and just keep looking at the website because there will be updates as you get closer as well, potentially. Okay, so we'll finish in about 10. Was there any more questions?
Is there a question, or is that just a statement, Rebecca?
Yeah, statement.
Yeah.
Okay.
Great writer, Gurdjieff. Great leader of a mystery tradition. He's very, very similar to the work of Oscar Ichazo, who Chilean psychiatrist who inspired a lot of transpersonal work. A lot of overlap between Gurdjieff and Ichazo.
So Diego, I might get you to pop the slides back up. I'll just a couple more updates that I'll share before we off.
Yeah.
Okay, so that's the criteria. For more information, please go to the CPAT website and ask us any further questions. And next slide. So yes, the International Summit on Psychedelic Therapies from the 17th to 20th of November, and incredible lineup of people. Some of them, just looking at Ellie, we've got a CPAT psychiatrist there, and I guess just to make a point, our hope through all of this is to skill up local talent and really grow a really strong ethical community of practitioners and bring opportunities through webinars, through training, through summits, so that we can have a stage in this kind of international arena. And
We'll also at the summit, Alana, Tra-ill and myself will be providing a workshop introduction to the CPAT. So people like to kind of get a bit of a taste of what we're teaching. You can sign up for that. See whether you like us or not.
Going to need to get a picture of your head on this poster, I think. Yeah, next slide, please. And we have lots of events coming up. We have, so if you join the YouTube, you can subscribe to the YouTube channel or the email and get updates, and lots of interesting international speakers from trauma from USA, future of psychedelics, paradigm shift from Canada, and the arcanic brain, revolutionary understanding of how psychedelics alter the mind from Canada as well. There's also 2 programs that Melissa and I are running, one in June on self-care preparation and integration. That's a 3-hour training open to the community as well as practitioners. And we're just about to release one in August on post-traumatic growth for sexual abuse with psychedelic medicine. So my background, been a sexual abuse therapist for 15 years, and I work with a lot of people in the community who are using these medicines or have gone overseas or are using them in the community or are waiting for trials who've had sexual abuse. And me and Melissa come from that place of lived experience with trauma and the medicines, and have weaved together a really beautiful program, a 4-hour program. It's for women at this stage. And I really invite you to have a look at that one, because it's going to be quite a special journey that we'll go on. So stay tuned to that. Next slide. The end.
We'll also offer at some point in the near future holotropic breathwork retreats. So keep your eye on the website for that if people are interested in getting an experience of non-ordinary state work based on one of the pioneers in the field, Stan Grof.
Yeah, and Nigel Denning. I personally can't wait for that, and we hope to have many mental health professionals as well experience holotropic breathwork, they might be quite nervous of psychedelics, and it's a first step into altering your consciousness, where you've got a bit more control to be able to stop that journey, as opposed to the full psychedelic peak experience. So it's going to be an amazing tool to be able to facilitate that space for practitioners as well as clients. So
Katie's got her hand up there. Katie.
I think she just hasn't taken it off, maybe, Nigel.
Oh, okay.
Yeah.
Oh, you're right. Sorry, I'll take it off. There you go.
All right. Any other questions before we head off? Are you okay with that? All good. Well, feel free to reach out at any point. We can answer your questions.
Thanks, Ashley. Pleasure meeting you all.
Thanks.
Hopefully our paths will cross again sometime in the near future.
Thanks very much. Yeah, we appreciate it.